Hi there. If you're a case manager who's perhaps needs some help with one of your clients and all, Norwill Health is a great option for you. And we're sitting here right now with Jackie and Ollie. And what can you tell these folks here about, like, what problems would a caseworker have that you can solve for them?
I'll let you start.
Well, a case manager is someone, of course, who is trying to coordinate the care for a particular patient.
Okay.
And they have to make sure that they have all the pieces in place so that this person can be healthy at home and get the services they need. And so they're looking for example, a home health care agency that may be able to provide home care, an aide to come in and take care of these clients or patients.
Okay.
They may be looking for a nurse to come in and do wound care or to do follow-up with certain procedures and have a communication back and forth to them, and so that they can document, and the referring physicians or whatever,
Sure.
so that they can document the care as it may go.
So how do you make their life a little easier? The role that you're gonna have?
Well, one of the things that is a challenge, of course, especially right now, is just a lack of help.
Okay.
And we don't have a magic ball. We don't have the answer to that necessarily as far as numbers go. But the best we can do is be available. Answer the phone. Their case managers are people too, and they have a lot to do. And managing, all these ins and outs of these people. And so, being available, answering the phone, answering the call, and then being attentive to their need.
Okay.
If they need us to be able to be there. Our thing is trying to be there within 24 to 48 hours to make sure that if we take a case that, a nurse is there to do the assessment within 24 to 48 hours.
Is there a certain process or a way that different case managers would work that you need to fit into in terms of what's the process of working with you guys?
Right, and I think there's two case managers we're talking about. There's case managers in the hospital
Yeah.
that deal directly with the home health care agency.
Okay.
And that's just a direct call, that's conversation. Can we take that type of patient on with their medical needs? But then there's also the case manager for the insurance company. So we're dealing with two different case managers.
Okay.
So the process would be they would contact us. We would review the case with them, what the patient's needs would be, if it's wound care, if it's medication, education, or just working with weight loss management and respiratory issues to make sure we're providing the needs for the client patient, and also with the insurance company. I think with their input is incredible because of the coverage, making sure that the supplies are going to be there, and all the equipment that the client will need, patient will need in the home. So there's a lot of steps that go through it, but the initial is the initial contact, the review of the client and what their needs are, and then a time frame. When is the patient coming out of the hospital? Will we be able to have that hospital bed, the commode, the shower chair, all the equipment that the client or patient's going to need in the home before they even get home? And once we get in, do they have the wound care supplies? Do they have the respiratory supplies that they need? Do they get their medications? Did they stop at pharmacy on their way home? So that's something too with the connection or the teamwork actually between us, the case managers, and then of course the doctors, with the conversation to make sure the patient is
A lot of communication
100%.
going on around.
Absolutely. And then while that's all in the works, then we have our other staff working on making sure we have a registered nurse and an LPN or a home health aide or STNA available to start the care.
You mentioned communication. For a case manager, communication is key.
Yeah.
Basically, because a lot of times it's not necessarily a one and done, but what they figure is that once they've let them go, they're not there to provide the care. They're not there to make sure things are going. So it's up to us to have a system in play. And we have a very, very good couple of systems actually that are very hardy. That track our notes, that make sure that we put in the right types of information in, and then to make sure that they have access, and how much access, of course, depending on what the client needs and will allow. Basically, for example, we have a thing called a family room, and in a family room, a case manager could, with the permission of our client or patient, can go in and look at when the last time this person had a visit, when the last, what medications is in there, whether or not they wanted to upgrade or update some medications, or they were planning on to when the next appointments are. And this is open for families as well, but it's definitely a good tool to use so that they can have access, along with with our ability to and responsibility to be able to contact these case managers and update them regularly about what's going on.
Well, that sounds like a really great tool, because it's always there. They can get on it. They can be sure that somebody was seen, what happened, and if you're a case manager, you have to know what's happening. Obviously, you got to be on top of it. And Norwill's a lot of talented folks working there, and it sounds like the communication aspect you've got to. That's something maybe sets you guys apart from some other folks. So. Oh, go ahead. It's okay.
Go ahead and brag.
Hey, if somebody's out there and does want to talk to you more, what's the best way of getting in touch with you guys? Is there a phone number they can call?
Sure, they can call 216-441-9669, or they can email one of us, definitely at OTTOMANN, the number 6 at norwillhcs.com. Or they can go right to our website at norwillhcs.com and leave a message, and someone will contact you directly.
Hey, and if you're on the website, be sure to look around. There's some other great videos like this that give you a real sense of what Norwill is all about, and I think you'll enjoy it. So, hey, thank you very much, both of you.
Thank you.